From high school graduates
I want to study public health because I feel like this pandemic really like impacted the way I feel, because I feel like I can help others who get affected, and I never knew that history can literally repeat itself.
to graduate school students,
Right now, seeing all the doctors on the front lines and hearing the stories about treating COVID patients, I think it really just kind of solidified that this is what I want to do, and it made me that much more eager to get started with med school.
public health and medical programs are seeing quite a spike in enrollment as COVID-19 continues to spread around the country, killing some 300,000 people.
We're seeing about a 25% surge, and that's typical in every medical school in the United States. The big disadvantage for the student is that if you have 12,000 applicants and you can only do 600 interviews, it really reduces the percentage and the likelihood that any one student is going to get an interview.
Some admissions officers are calling it the Falchi effect. Students want to follow the example of professionals like Dr. Anthony Falchi, director of the National Institute of Allergy and Infectious Diseases.
And I really must tell you that many of them are profoundly affected or impacted. They're witnessing the terrible suffering due to the COVID-19 pandemic. So it's come into their consciousness, the fact that we really do have some difficulties in equitably distributing healthcare in the United States.
They see it as a call of duty.
But I do think the Falchi effect is absolutely real because I kind of feel it myself. It kind of reminds me a lot of 9/11, and when we saw that in the United States, this big increase in military service after 9/11.
This surge in medical school applications comes as the U.S. is projected to face a shortage of physicians. More than 2 of every 5 practicing doctors are expected to retire over the next 10 years.
In addition to fierce competition and the exuberant costs of medical school, this new wave of physicians faces another challenge.
They have to build more trust in the population as a whole so that people are willing to take their recommendation and advice from public health experts and not politicians who have a political agenda.
And yet, they do not seem deterred. They're fully aware that they might have to roll up their sleeves and be at a patient's bedside while staying away from family and friends. They lived the 2020 pandemic and they still want to be doctors. Nitza, Soledad, Perez, CGTN, Miami.